All right, hand hygiene. Hi, my name is Sean Burns. I'm going to be your nurse today, Mr. Bear. All right, Mr. Bear, can I check your identity on your bag? On your wristband. Okay, Mr. Bear, 1974. All right, thank you, Mr. Bear. All right, so today we have an order from the doctor about a Foley catheter for you. So you're going to receive a Foley catheter for your urinary retention. And I have my kit here, and we're going to remove the blanket and insert this Foley catheter tube into your penis, and then that is going to help with the urinary retention. Do you have any allergies to shellfish or latex or iodine? You don't have any allergies? Okay, cool, Mr. Bear. I'm going to remove your blanket and we're going to get started. I'm going to move your legs to the side. Okay, thank you. So now I'm going to wash your penis. So I'm going to grab some gloves, put on my gloves, and get a washcloth. And I'm going to wash the perineal area in the penis. So I wash around the penis, starting at the glands, moving outwards and down the shaft, and then I can clean under the scrotum if I need to. And I assess for any infection or any abnormalities, and would document that later if I saw that here. So looks all good, Mr. Bear. We've cleaned you up. Now I'm going to grab my kit. So this kit has already been opened in the lab, and would have a few other things, but for the sake of this video, we'll pretend that it's closed like this. It starts off closed, and then you would open each side away from you, and you don't reach over it. So just showing one side, you would open it away from you. You would get the memory out of it, and then you would open another side, get the memory out of it, and then open the remaining two sides away from you. And then we would grab our sterile gloves out of the package. Go to a flat surface that is above hip height, and we would it would be away from this. I just don't have much room in this video. So you would put your sterile gloves on a flat surface, and you would open them up, creasing the memory to open up the gloves. You grab the gloves, being sterile, you correctly put on the gloves, and then now we have our sterile gloves on your hands, stay above the waist. So now I'm going to grab my waterproof pad, and I'm going to put my hands under it, wrap my hands around it, and place that under the client's penis. Alright, so now that I've done that, this is all sterile still. You would maintain that 1-inch border, and you wouldn't reach over this kit as much as possible. You don't reach over the kit. And then we have a fenestrated drape. Open up the fenestrated drape, it's already been torn. But we would put the fenestrated drape so that the client's penis is sticking out of the hole of the fenestrated drape. And now we will remove this part, this lid, and we would remove the iodine swabs and open this and save it for later. We're going to use it in a bit. And then we will get out our lube, and we will open it and pour the lube into the tray. And then we'll attach our syringe onto our port. So here's the syringe. We'll attach the syringe onto the port. And then when removing this from the bag, before that, okay, so yeah, we've attached that to the port. Now we're going to clean Mr. Bear's penis. All right, Mr. Bear, I'm going to use these swabs. So you open up the swabs, and now we grab the penis. All right, Mr. Bear, before you grab the penis, Mr. Bear, I'm going to touch you. I'm going to grab your penis, and then I'm going to clean your penis. Okay, so Mr. Bear, I grab the penis, and then I start from the inside out. I start from the inside center of the glands of the penis, and then work my way to the outside and down the shaft. And then when disposing this, I just drop it, because I don't want to bring my hands below hip height, because then I'm contaminated. And now I'm going to grab my catheter, and I'm going to make sure that it does not, the tip of the catheter does not flail around, because it's very easy if you just pull up the catheter and without coiling it or without grabbing this part of the catheter, it can hit something or go outside the sterile area and get contaminated. All right, Mr. Bear, I'm going to insert this catheter tube into your penis now. Just take a few deep breaths. So we're going to insert the catheter tube without touching the client's penis. And you just thread it in with your hand all the way to the Y. You grab the Y of the catheter, and with your contaminated hand, you can grab it. And then your other hand, you're going to instill the 10 milliliters of water, keeping pressure on there. You'll see the fluid flashback. You remove the syringe, and you can dispose of that, put that to the side depending on facility policy. And you can see that the catheter will pull out on its own, and just making sure that that balloon is in there, and you don't want to pull on it. You just want to check that the balloon is inflated gently, and because otherwise you could hurt the patient if you pull on it. Pull on it really too hard. And then now we are going to take the bag. We can let go of the client's penis now, and we can remove our gloves, wash our hands, hand hygiene, and put on some new gloves. And then we're going to move our bag down to the side of the railing so the catheter's attached, and not the railing, excuse me. We're going to put this bag onto the bed frame. And the reason we don't put it on the railing is because the railing moves, and you don't want the bag moving around. And you also don't want the bag at the same level or higher than the client's penis, because then the urine can flow back into the tube and potentially into the client's penis and urethra, and that would cause risk for infection and endanger the patient. Okay, so this is below the rail of the this is attached to the bed frame, this bag. We can tape the tubing onto the client's leg, and then we will go ahead and remove and clean up. So you tear your fenestrated drape, and then you grab everything else. You get all of your supplies. And the client is there. You throw this away in the garbage, and then you can cover up the client. Everything's taped to the client. The balloon's inflated. The bag's on the bed frame. All right, Mr. Bear, if you have any questions, please let me know. Everything feel okay so far? Okay, cool. So here's your call light. If you have any questions, you can call me. All right, so that is that interaction. And then when you come back and it's time to remove the catheter. Hi, Mr. Bear, hand hygiene. Can I check your identification real quick? I'm John Burns. Okay, and you are Mr. Bear. And Mr. Bear 1724. All right, cool. So, Mr. Bear, everything is looking good, and it looks like we have the order to remove your catheter now. All right, so we're gonna go ahead and remove that catheter. I'm just gonna remove the tube from your penis. And so first I'm gonna uncover you, Mr. Bear. All right, cool. So everything feel okay so far? Awesome. So then you can don some gloves. We've already hand hygiene the first thing we walked in. You can hand hygiene again before you don the gloves. And then you grab a pad. Oh, sorry, before the pad even, we're going to empty the bag. So we're going to empty the bag into a cup, and we're going to assess the measurement of that urine that came out of the bag. And then once we've done that, we can put the bag on the bed and get our waterproof pad if we want to. Yeah. And yeah, we want the waterproof pad because we're going to be removing the wet catheter. and then we can remove the catheter now. Remove this tape, and we have a syringe in which we're going to deflate the balloon with. So, all right. So now that the pad is in place, you can do hand hygiene and don gloves again if you want. New pair of gloves from the urine, and then yes, you definitely want to have a new set of gloves from when you got the urine. Okay, so then we are going to remove the catheter. All right, Mr. Bear, so I've put this pad under you, and I'm going to remove your catheter. So what you do is you put the syringe in here and you deflate all the air out, and then you pull the catheter out without touching the client's penis, and then you catch the end of the catheter, and then the catheter and the bag can be disposed of or put away, and then you can put away your supplies and throw it away. And Mr. Bear, oh, I have some dribble, can you clean that up? So you can clean that up for Mr. Bear, so you can wipe him down with a peri-wipe or washcloth. All right, thank you, Mr. Bear. You're all good? Okay, cool. So Mr. Bear is all happy. You have any questions or anything like that? I'm going to cover you up, Mr. Bear. You don't have any questions? Everything is good? Okay, cool. So here's your call light. Now I have some patient teaching for you. If you, when you have your first urine, it's going to burn a little bit. It's going to hurt because we have the catheter procedure. That's normal. But do please call me when you have your first, when you have to go pee. So when you have to go pee, hit the call light, and I'll come and I will come and help you with that process, or explain that to you further whenever you have to go pee. And then I'll check your 5 P's, your pain, potty, possessions, and pumps, the 5 P's. All right, Mr. Bear, thank you, and your hand hygiene, and then you can leave the room. And that is the skills check for the Foley catheter.